So I'd like to invite Dr. Erica Person up. So Dr. Person's come all the way from the University of Alberta, past CHASM president, one of the few pediatric sports medicine physicians in North America, and definitely within Canada. And we're delighted to have her. Thank you so very much for making the trek.
Awesome. Can everybody hear me back there? I have a tendency to yell, so I don't want to make this thing squeal. So thanks for the organizing committee to invite me here all the way to chat with you guys. A topic that is timely, but also potentially controversial. So I welcome your input as we kind of talk about the trouble with 10,000 hours. No disclosures to make apart from I'm a team physician with State Canada amongst other national teams, so I get some honoraria for that. Past president of CHASM, but have no patents or other financial relationships or investments. But if people have ideas, I'd be happy to chat. All right, today, 4 objectives. To understand the definition of sports specialization and its roots, to be able to recognize both positive and negative effects of sports specialization in youth and teens. I want to increase your comfort in having these conversations with various stakeholders, including athletes, parents, coaches, sport organizations, and just the community in general. And I want to encourage you to advocate for best practices within youth sports. So what are we talking about? Pediatric sport injury. Let's scan the environment a little bit. 68% of Canadian youth and teens up to 17 years of age participate in sports. Is that better? And this is some data done from a survey done in 2022. Some Alberta-specific data, because I have to bring some West Coast perspective. 87% of teens in a 2019 survey of high school students participated in sports, and you can see there between males and females what are the highest participation sports. We see 66% of injuries in youth are related to sport, and if we look at emergency department visits, 30% of all these visits are due to injuries, and of those injuries, 40% are sports related. So we're seeing this all over the place. We see about 1/3 of teens reporting at least one sport injury requiring medical attention from, again, this 2019 survey. And the cost of these injuries are up to $187 million annually. So it's not a little drop in the bucket. It's quite a lot of cost for society and our healthcare. The top 15 sports here in Canada, again, this is a 2022 parent survey, so this is Canadian data. Number 1 sport, soccer, then we followed by basketball, hockey, ringette. I was kind of surprised at that. I thought hockey and ringette would probably be a little bit higher on the list. And then lower down on the list, we've got football, rugby, ice skating, and your racket sports. But we can see lots of different sports throughout the various genres that kids and youth participate here in Canada. So why do kids get hurt? What are some injury risk factors? We probably all are aware of this. But children have less developed motor coordination, so they fall and collide with each other more often. And this is part of their development as they go from being a toddler to being an adult. We see progressive development of their muscular control. They play hard. How many of you guys have kids out there? Yeah. How many of you know children? Either relatives? How many of you are children right now? Yeah. So you know that they go hard, right? We've got overtraining and lack of rest and early sports specialization, and those are the 2 we're going to talk a little bit more in depth about coming up. We see increased training intensity at earlier and earlier ages. Kids are not little adults, and adults are not big kids. They've got open growth plates, and these are the weak link, especially during periods of rapid growth. The apophyseal attachments of the muscles to the various growth centers. The bones are porous and pliable, so they often will bend, strain, sometimes they'll break. We also see growth as a huge injury risk factor, and there's a mismatch between the muscles and the bones as they grow. So what's our current landscape of youth sports? So this is where we're going to get into some a little bit of the controversial things. So I just want you to think, when was the last time you saw a group of youth playing in your community without anybody supervising them? They don't have uniforms, there's not a ref, there's no jerseys. They're just out there having fun. When was the last time you saw that? Probably not, right? Because it's becoming rarer and rarer. More organized sports are happening and less free play. Kids are just not going out there and playing. We're seeing a focus on sport-specific skills rather than well-rounded development. I'm going to challenge you. Can this shift be changed? Can we go back? And I'm going to say, yeah, we can. Next kind of topic to think about. How many multi-sport athletes do you know in junior or senior high school? Just think about that. How many of them are just playing one sport? How many are playing 3 or 4 sports? A reduction in multi-sport athletes are going down due to the widespread pressure and expectations for single sport specialization at younger and younger ages. This is becoming the new normal. But again, I'm going to challenge you, should this be? And then thirdly, what does society expect? Participation of youth athletes on multiple teams, from your community team to your club team to your school team, all in order for this to be worth it and successful. But why? Where did this expectation come from? Why are we thinking this? Why is society thinking about this? And some quotes that I kind of found, I thought this one was really interesting. Your daughter is already 4 and still can't pass a soccer ball. She's so far behind, she'll never make it to the Olympics, much less win. I think if you put a microphone in the audience or the stands of any youth sporting event, you're going to hear comments like this all the time. So this is what parents are up against, right? And us as physicians or healthcare providers are also up against this expectation. Another quote was, if my son doesn't play baseball in the fall, they won't let him play in the spring. So we'll get into that in just a second too. So what is sports specialization? What is the actual definition? And this was from a paper from the AMSSM in 2016. It's defined as a year-round, more than 8 months per year, intensive training in a single sport at the exclusion of other sports at a pre-pubertal age. That pre-pubertal is important. So these are your kids that are 7, 8, 9, 10, 11, 12. We're seeing younger and younger children doing exactly this. And I'm sure you can probably all think about 7, 8-year-olds in your practice that are doing exactly this. It often began with individual sports, such as gymnastics, dance, tennis, and figure skating. But now we're seeing the pressure and this single sport specialization evolving into our team sports, football, soccer, basketball. Often these programs are not school-based, but rather independent, with the focus on one singular sport. You may see them labeled as select, all-star, travel teams, and these operate as business ventures with significant costs to participate from the families and the individuals participating, but also significant revenue to be made by the organization that's hosting it. The majority of parents and families are unaware of what the current recommendations are and also the effects of early sports specialization. And we think early, this is prior to puberty, one sport only, and we do not explore other sports. Versus late specialization, which can be also called sampling, this is after puberty, and they're sampling various sports as they continue to develop. So why? What's the motivation? Why do we see this happening? We have thoughts about getting to college and university and this concept of a free ride. We want kids and their families want them to become Olympians. We're seeing young teen phenoms at the Olympics and all over social media. I'm going to use an example of Summer McIntosh. Fantastic athlete, but she's a teenager, right? And how are parents comparing their own children to these individuals that are quite exceptional? To get to the pros and become the next Kobe, Otani, McDavid, or Sinclair. To fulfill a parental desire or reliving a parental dream from the past. So hopefully you've all seen some of this stuff, is that this is the parent's dream, this is not the kid's dream. They want to be out there playing kickball with their friends on the corner, not spending 15 hours in the tennis court, one-on-one drilling balls. That's not what they want to do. We have this concept of talent identification programs, and these are starting to become another big business. And we're starting to identify kids at a very early age as special, a generational talent. They're exceptional, they're gifted, they're a child prodigy. All these very grandiose sounding words. We see private industry looking to profit from youth sports specialization. There's lack of time to do multiple things. Some of these kids are self-driven and they've just got that inherent ambition and choice to become better at one sport, which we want to support. But we also have to realize that there's push and advice from parents, coaches, and family members. So how do we balance these? There's individual passion for sport that can cause kids to kind of go into one thing. This FOMO, as we all kind of know, everybody knows what FOMO is. If you don't, fear of missing out. There you go, if you didn't. And then the financial. So there is, and this is something when I was putting this together, I came across, there's a policy from 2021 from the NCAA in the States, the name, image, and likeness policy. And this, I think, is going, and it's been thought that this is going to create some pressure on kids and teenagers to succeed in sports so that their name, image, and likeness can be, their name, image, and likeness can add to their family's financial success and their own financial success. So something to watch out for. Statement from the American Academy of Pediatrics in 2016, the biggest motivator for sports specialization at a young age is not the youth. It's rather the parent that is the impetus to start the sport, and the coach is the primary influence on intense training and sports specialization. So this is a whole big society problem, not just a kid and a parent problem. So why are we seeing this? Why did I pick 10,000 hours? Hopefully most of you have heard of this 10,000 hour principle. It was something done by a study in the 1990s by Erickson, who was looking at chess players and musicians. They were not looking at athletes. But what they were looking at is deliberate practice to achieve success or mastery at a complex skill, comprised of 3 stages, starting at an early age, specialize and increase participation, and then dedicate full-time commitment. And you needed to put 10,000 hours in over 10 years to achieve this. Unfortunately, this has been misapplied to sporting success and has become deeply ingrained into sporting culture as a requirement in order to achieve success. However, if you look at the data and look at real-life examples, there's many athletes that have achieved success without this, and many others who have not achieved success with more hours. So what makes somebody successful in sports? Multiple things: exposure, training, individual physiology, individual ability, genetics. Who knows what that family is? Who knows that family? Shout it out if you know who that family is.
Nurse.
The nurse family, right? So multiple, not just one individual parent child, there's aunts, uncles, cousins, and it's across sports. So there has to be something for genetics in there, right? And you can see other examples of various other families with very similar kind of successes. And we don't know the exact volume of training exposure to achieve success. We don't know that. We also don't know the threshold exposure to avoid negative effects. So some work still to be done. So let's start with the positives of sports specialization. Specialization increases your sporting success compared to not specializing. However, the timing is the important part. When we look at NCAA Div 1 athletes, they are more likely to participate in multiple sports in high school, and often their first sport is different than their current sport that they're participating in. If we look at NFL Combine invitees, 87% of the ones in 2015 played multiple sports in high school. And late specialization with early diversification or sampling is most likely to achieve elite sports status and success across sports. And there's a number of studies across the globe that actually bear this result out. However, I'd like you just to keep a little caveat in the back of your mind, and it depends on where you're living actually. If specialization is allowing a youth to escape a dangerous environment, be it their school environment, be it their home environment, be it their community environment, then by all means, if this is something that's keeping them safe by spending 16 hours a week in the tennis court, let them do it. Okay, because if the alternative is then potentially being at risk of significant harm, physical harm, mental harm, bodily harm, then we would want that to happen. There are very few examples of successful single sport athletes that made the transition from youth to college and professional Olympic sports. How many tires can you guys name?
Roy McIlroy.
Okay.
That's where he really is.
Okay.
Vladimir Guerrero.
Okay.
Probably more soccer players.
Oh, we'll have some other examples out there too. But yeah, it's not like they're popping out of the woodwork, right? So they're very few and far between. We see the benefits of participating in youth sports, which you probably all know: leadership, fun, self-esteem building, teamwork, physical activity skills, peer socialization. But the benefits of single sport specialization early, there's relatively few. So what are some of the pitfalls then? And we can classify these into physical, psychological, and social and environmental. From a physical aspect, you're going to see increased rates of acute and overuse injuries. overtraining symptoms, reduced sleep, reduced motor skill development because they're not being exposed. So how many of the kids who are playing soccer and only soccer can kick a ball fantastically, but they have no idea how to throw a ball because they're not exposed to it? The psychological aspects: burnout, reduced intrinsic motivation, arrested behavioral development, increased rates of anxiety and depression, reduced experiences of fun and enjoyment. That's what sports is supposed to be about. It's supposed to be fun. It's supposed to be for your enjoyment. When we look at social and environmental pitfalls, kids are quitting sports altogether. Kids who specialize early retire earlier from sport and have shorter careers. There's social isolation from their peers and their family. There may be increased rates of abuse in various situations due to overdependence and that power dynamic, and reduced quality family time. For those of you that have children out there and that are involved in sport at a high level, how much good quality time do you guys have just to sit at the table, have dinner, and chat about what your day was happening? Or are you running off to here, to there, to everywhere, having dinner in the car, maybe not having dinner at all, right? So something I think we need to think about. Other pitfalls include the financial cost. There's been some reports that some families spend upwards of 10% of their gross income on sporting costs for their kids. That's a lot. There's also widening gaps between the haves and the have-nots. And this shows the influence of our socioeconomic status. We see kids who specialize early, their overall elite performance at older stages is reduced. This is possibly harmful, but definitely early specialization is not hopeful. We see less participation in sport as adults. Their sport situational IQ is reduced given the lack of exposure to various sport situations and the lack of that development of those transitional skills, strength skills, balance, agility, speed, jumping, running, throwing, kicking, all the basic skills that kids and youth should have. We often see reduced academic performance, and we see reduced exposures to other activities, both sport and non-sport. And this is something to think about. If a child or a teenager is not exposed to a certain area, how do you know that this is not their special talent or their innate, this is what they're meant to do if they've never been exposed? So let's expose them, see where their strengths may lie. And this is kind of just a brief kind of maybe side on long-term athlete development. I know this is not what this talk is about. But these are programs created in the 90s to combat the negative effects of sports specialization. These are positive frameworks to develop physical literacy skills in and elite athletes. We go from basic movement and moving on up. And these can be translated to different ages and bring forward as a person develops. The one from Canada, 2019, Sport for Life, the long-term development in sport and physical activity 3.0. Starts at the bottom there with the active start, then your fundamentals, then you're gonna learn to train. And then as you get older and wanting to move, you're gonna train to compete, and train to win. But then parallel to this is you've got your competition for life, fit for life. So it's a whole interdependent framework. So if you're interested in this, I'd encourage you to look at that a little bit more. But the concept of long-term athlete development. So some of you are probably thinking, well, what about those sports that they actually need to specialize early? Things like dance, gymnastics, figure skating. Why is it? Why we see those things is because often they hit their peak performance prior to full biologic maturation. There's no conclusive data to show that there are specific long-term harms apart from a trend towards more overuse injuries and the relative energy deficiency in sport, RED-S, but there's no data to support stunted growth or stunted development. So just something to think about. So you can have athletes like this. How are you gonna keep them healthy? What are you gonna do? You're gonna encourage them to cross-train and strengthen and move their bodies in different ways. This will help them to become better at their individual sport, but will also help them to prevent those injuries. You want them to have a knowledgeable sports health provider on their team so that they can address these issues as they come up early. You want to have a regular check-in with your youth to see if they're enjoying having fun and enjoying training. And you want to give the child the option always to be able to say no when it comes to training or continuing training. I can think of a sport specifically, gymnastics, and I'm not picking at gymnastics for any particular reason. I work with a bunch of gymnasts. But that particular sporting environment, they are encouraged to stand there. You've probably seen it. Stand there. Yes, go. They're saying nothing. They can't speak. They're not encouraged to speak. So giving and encouraging your athletes to have a voice and speak up is important. And you can start by just with this, encouraging them to talk to their coaches and say, hey, I'm not having fun at doing this anymore. Do we have to do this all the time? And then encourage good training habits, including recovery and rest times. Build it into their schedule. Just like math class, the second period, when are you taking your break from your sport? When are you getting your sleep? When are you doing your recovery time? Put it into their schedules. This is a long quote from the end, and I think it's from the IOC back in 2015. I liked it because it talks about individuals' early sport specialization, but how to do it safely. Appropriate diversity and variability of athletic exposure within a single sport, while supporting sufficient learning of fundamental and foundational skills and sport-specific technique and biomechanics to minimize injury risk and optimize performance, along with consistent adequate rest and recovery and a balanced emphasis on other priorities, their family, school, life skills, social development, can be acceptable and healthy so long as the youth athlete is enjoying and benefiting from the experience. So just something to think about. So one slide here on the business of youth sport. There are lots of contemporary books being written about this, and you probably all have your own feelings on the whole business of youth sport. This is a multi-billion-dollar global industry. Promises of the pathway to elite success, scholarships, and professional careers, and it's very financially lucrative for the business owners and potentially for the very few individuals that make it to the highest levels. I think there's some predatory behavior happening. We have businesses pretty much saying things to families without any data to support the increased success. And these are sport enhancement programs consisting of conditioning or skill development with lots of cost and time commitment. These programs also refuse admission to children and parents who will not commit to their 6, 9, 12 months out of the year to their individual sport. You probably have heard stuff like this. Well, you can't participate here if you're going to do that or that. Why? Why are we saying that? Why are these individuals saying that? Recruitment. We're seeing lots and lots of national rankings of like elementary and junior high athletes. Why are we doing this? What is the point? And by doing this, we see increased pressure on families to do absolutely everything possible to help their child succeed and get scouted. And then the peer pressure and parental fear. This is like keeping up with the Joneses to the nth degree. Like, it's crazy. The FOMO if they don't do specialized teams, training, and specialization resulting in a loss of scouting potential. And they fear their children are really going to miss out or fall behind if they don't specialize. They may know, like, yeah, I know all this. This is all bad stuff. But if I don't do it, my kid's not going to get all the opportunities that the other kids have. So, things to think about. Some numbers. As many as 70% of teens discontinue playing organized sports by 13 years of age. That's young. Only 1% of high school athletes who will receive any form of a scholarship. 1%. At least 50% of athletic injuries are related to overuse. Between 3 and 11% of high school athletes compete at the college level. It's not a lot. And between 0.03 and 0.5 of high school athletes reach professional levels of sports. This is the data. These are the numbers. Here's some more numbers from the NCAA report back done a number of years ago. And I've got the column in green sort of highlighted, and this is the overall percentage of high school participating athletes that make it to the NCAA in various sports. We've got the men in this first table, and you can see the highest rates is 13% in ice hockey, and the lowest is volleyball at 3.8. Basketball at 3.6. So not a lot, just making it from high school to NCAA. If we look at the girls and the women, similar numbers. If you want to pick one, be a female ice hockey player, just not a goalie. That's my niece. She's a goalie, and there's some issues that way. But you got a 1 in 3 shot there, making it from high school to NCAA. But let's take it one step further. How many of the NCAA athletes that make it to the NCAA get to the major pros? And here, the numbers just speak for themselves. So the chances that your child, who may be really great at hockey or really great at volleyball in junior high and high school, the chances that they're making it to the college level are slim, and the chances of them making it pro or to the highest elite level possible is even slimmer. It's a sad fact, but it's the fact, okay? And I think it's upon us to talk to families realistically and honestly about those things. So what are our current best practice recommendations? We've got multiple expert groups from the IOC to the American Academy of Pediatrics, AMSSM, have published consensus statements over the last decade. The suggestion is to delay sports specialization until after puberty, so they think probably 15, 16 years of age, so that the individual can acquire developmental milestones to permit safe training at a high level. The individual can make decisions independently about their training desires and wishes. They can understand the benefits and risks of participating in only one sport. We want to use the long-term athlete development models and encourage basic physical literacy skills and deliberate play. Participation in one organized sport per year. Establish sport-specific guidelines to prevent overuse injuries and burnout. You've probably heard of pitch counts in baseball. If you've not, look it up. And age eligibility rule in tennis, which I thought was quite interesting. And you have to get to a certain age in order to participate in increased numbers of tournaments as a youth in tennis. Training hours per week should be less than the age of the individual. So if you are 11, you should be training 11 or less hours per week in your sport, or less than 16 hours per week in general. And they all encourage to open the dialogue to change the norms that we're all thinking about and seeing. Another statement from the IOC consensus statement in 2015, children who participate in a variety of sport and specialize only after reaching the age of puberty, for example, tend to be more consistent performers, have fewer injuries, and adhere to sports play longer than those who specialize early. So the data is there. So now I'm going to challenge everybody who's sitting in the room here today. I want you to talk to your families about how much your athlete is doing when they come in to see you. And this is in all of their environments, not just elite environments or high-performing environments. Make it like your vital sign. I ask every kid who comes in and sees me, what sports do you play? How many teams are you participating on? And how many weeks are you doing, or how many hours a week are you doing something active? We can get both the kids who are doing way too much and also the kids who are not doing enough at all, but their parents think they are. So we can kind of hit it at both sides. We want to focus on fun and enjoyment of sport rather than the competitive nature when communicating with families. Not saying, okay, how did you place in that tournament last weekend? But what was the best thing about that tournament? What's the most thing you had the most fun about? So flipping the script, focusing on the fun and the enjoyment. Become advocates in your own community to change the narrative. Be a myth buster. Make it the norm to do different sports throughout the year. Encourage free play. Let the kids lead the choice if and what they want to specialize in. You want to support the youth in finding their own passion. The much maligned specialization in youth sports is a recognized concern that also needs to be addressed appropriately and realistically. Another statement from the IOC in 2015. So how can we do this? This was a sort of a 3-point scale from Jayanthy about sports specialization. It's 3 questions to determine are they low, moderate, or high in their specialization. The first one is, can you pick a main sport? This is what you'd ask the kid. Did you quit other sports to focus on a main sport? And the third question, do you train for a sport more than 8 months in a year? If they answer yes to all of those, high specialization. If they answer 1 yes, low, 2 yeses, moderate. So something easily to ask about. Again, it's just something to help open the door, open that conversation. So how can you help? I want you to shift your focus in sports to having fun and developing basic physical literacy skills for everyone. Encourage all of your families to participate in multiple sports until puberty to reduce the chances of negative outcomes. Break the myth with fact. More success is obtained when participating in multiple sports until later adolescence. We want to support sampling and later specialization if elite participation is the goal. Assist athletes in determining their own individual sporting goals, separate from the goals of their family, friends, and coaches. Encouraging their parents to monitor their training environments and encourage awareness of best practices. You may want to suggest 3 months off per calendar year, can be in 1 month blocks, away from their primary sport, doing and moving differently. Support 1 to 2 days off per week for rest and recovery for youth athletes. You wanted to monitor those that are training intensely for early features of negative effects, signs of injury, psychological distress, burnout. I can say though, the second last 2 points is, I talk about that actually with a lot of families when they're coming in with various injuries. And so, okay, tell me when your rest day is. When do you take a day when you're not doing anything? And a lot of times the families are looking at me like, well, they can't because they've got this, they have to do this. And I'm like, well, can you perform if you're at that high level all the time? No, we have to recover our bodies. So make it a norm in your conversations. This is an infographic on very similar to the words on the previous slide, what guidance, talks about recovery, primary focus, play a variety of sports, early diversification, later specialization. This was taken from a publication from the American Academy of Pediatrics in 2016. So just a different format, visual format of what I just said. So, advice in the wild. What's some real world examples? There have been many surveys of athletes across sports at the highest level, including Olympic and professional sports. And what these athletes are saying is that they didn't specialize early. They don't feel that early specialization is essential for success. They encourage sports sampling. Multiple sport participation during their early years they found was beneficial and valuable for their overall success. And something I thought was quite interesting, they wouldn't recommend it for their own children to specialize early. So, using some of these facts, using some of these data when you're talking to your families. And here's my notable multi-sport athletes and what sports they participated in. Steph Curry did a bunch of sports, Michael Jordan, basketball and baseball. And you can see the picture on the side from his professional career. Tom Brady played baseball, Steve Nash soccer and basketball. Trey Savage, I'm here in Toronto, so I had to put something in about the Blue Jays. That was sad. I'm sorry, guys. Football. Roger Federer played a bunch of different ones. Jackie Robinson, old school. Abby Wambach played basketball, apart from soccer. Jordan Spieth, golfer, played a bunch of different things. LeBron played football. Kobe played soccer. Christine Sinclair played baseball and basketball. And Gretzky played lacrosse and baseball. So lots of well-known names, and I could probably find more. These are just the ones that I kind of thought off the top of my head and could find some clear information on. So they're out there. Use these guys as your good examples rather than the Tigers, right? In sort of summary, conclusion, what, this was a paper done in actually just recently, and they looked at sports specialization, early high sports specialization, and what are some of the outcomes from injury to function, performance, sports success, and psychological. And in the green highlighted column there, most of the conclusions were that early and high sports specialization were associated with negative outcomes in injury, negative outcomes in performance, negative outcomes in sports success, and negative outcomes in psychological outcomes. So the data is there. Just something to think about. I'm not sure, Neil, are they getting copies of this presentation?
So we have a live stream, and then yes, we'll break it down to the English, and all be available on Sportmax Go free.
Perfect.
We take copies.
Yeah, no worries. I wasn't sure about that. So yeah, so this was taken from a paper in 2016, just kind of 7 postulates, just again, things to think about when you're having the discussions with families and how to approach the sports specialization topic. So, Mythbuster, early specialization does not equal long-term athletic success. It doesn't happen. Here's my call to action. We need to change the societal norms around training kids like little pros. We want to call out those that acknowledge the issue, but also say that this doesn't apply to my child, my sport. Because it does. So I'm encouraging you guys now, after being here, to go out and do these things. Put that change into your practice. Okay? It's not going to be easy, but if we all start to do it and all start to spread the words, things are going to start to change. So, what have we done in the last 35 minutes? We hopefully understand what sports specialization is and its roots. I hope you're able to recognize both the positive and negative effects of sports specialization in youth and teens. Hopefully you're going to be a little bit more comfortable in having these conversations around sports specialization with various stakeholders. And I hope you're going to become an advocate for best practices within youth sports. So, I think I've got about 10 minutes. I don't know if I plan that right. Don't all jump all at once.
Yeah, I guess I'll start, so the question I have really is, it seems like from a cultural perspective, parents and families almost can't help themselves.
And part of the issue is driven by the clubs, that are engaged in this process of having multiple sessions a week, mandatory attendance for matches and tournaments on the weekend. So what do you recommend in terms of the engagement with the actual sporting clubs to try and change this behavior? Thank you.
Yeah, great question. Start the conversation. Open the door. Say, hey, I see this is happening. I've seen, and you've been using some examples. And I can give you an example of how I broached this with the gymnastics gym now probably 8 years ago. I was seeing a bunch of kids from the same gym at the same time with different injuries, different ages, same part of the season, but I wasn't seeing kids from other gymnastics gyms. And I'm like, hey, what's going on at this gym? And I chatted with them. And it was a little challenging to start with, but I was able to open a dialogue. And they were doing some great stuff, but the way that they were implementing it, they just didn't know. So they were doing strength and conditioning, which was great, but they were doing Olympic weightlifting with a room of 15 to 16, 7 to 16-year-olds, all in the same room doing the same thing with one supervisor. So a little bit of a recipe for disaster there. So we were able to intervene and kind of say, hey, this is what the best practice is. This is what our data shows us. This is what we would like to do. Make some early changes, small changes, one thing at a time. And now lo and behold, this gym I'm actually at now, I've come in, I'm working there a few times a month, seeing their kids. And we've seen some of that shift in that culture. The kids are speaking up, the kids are talking, the parents are talking, the coaches are like, okay, yeah, you're hurt. You don't have to do that 25th Jaeger on the bars. Let's do something else, right? So start the conversation. Be brave to start the conversation. They want to hear from you. I think if you can present it with data and present it with what the current best practices are, they'd be willing to have and entertain that change. It may not be quick, but you have to start the ball rolling somewhere.
Thank you very much.
Yeah.
Hey there. Is there any data about how different the sports specialization has to be? What do you do with the kid who says, yeah, I played box lacrosse in the winter, field lacrosse in the summer, or I'm the quarterback in the fall and I pitch in the summer?
In terms of data on
if that's enough to prevent overuse, injuries.
Yeah, I think if we can say that if they're taking that 3 months out of the year in 1 month chunks away from their primary sport, so if you could talk to that athlete and what do they identify as their primary sport, if they say no, I can't, and I'm equally participating in my football and my lacrosse similarly, and then maybe doing something else on the side, I'd say that would be classified as your multi-sport, right? It's not just one, and they're taking that time away. For the data on the injury rates, I have to look that up. So I'm sure it's out there. It wasn't something that in terms of I was focusing on specific sports and their injury rates based on how much they're participating.
I was asking more if they're effectively just a throwing athlete, right? If they're a pitcher in the summer and spring, and then their other sport is football, and then the quarterback and throwing 60 passes every whatever.
True, yeah. And what I would then is I would encourage them to find a third something to do, or while they're doing the throwing as well as the baseball and football, are they going to do some swimming? right? Are they gonna do, maybe take up some cross-country running? What are we gonna do that way? How are we gonna move our bodies a bit differently? And letting them drive that, because it may be what they're interested in, it may be what they have access to as well. They may not, if you're coming from I'm in Alberta, so we've got a lot of rural people, they may not have access to all these big fancy facilities with all this big fancy training stuff. So what can they do? Can they take their dog for a walk, grab on their bike with their helmet and go that way? Fantastic, let's do those type of things. So let them kind of drive what the other thing they may be wanting to explore. Summer is also a really nice way to kind of get the kids to sample a bunch of things and explore things, because various organizations have summer camps. Try this out or try that out, right? So getting them just to kind of brainstorm early, but asking the question to start with.
Do you think like the onset of load management in professional sports is a positive tool you can use in discussion with these children and student athletes?
100%. The question was about load management in pro sports, and can we use that tool as a talking point for our youth? 100%. I do it all the time, actually. And I mentioned, like, remember back in the day, like Kawhi, and when he couldn't participate in this, that, and the other thing because of his Achilles, and they had load management. And I said, we can do that with you too, and I want to do that with you and the families, and just giving a rationale about why. And I find families are very receptive to that. It's using some of those pro principles, but diving it down. Yeah, for sure. Yeah.
Good morning. I was just wondering, is there like a specific time where you start encouraging kids to be more specialized in one certain sport?
Yeah, and I think that's where a lot of the consensus statements are saying is kind of after puberty. So that's kind of that sort of 14, 15, 16 age to kind of look at that. And I think their long-term athlete development programs actually look at that as well. And these are for your later maturing sports. So put an asterisk, your dancers, your figure skaters, your gymnasts, your tennis players. I don't have a lot of tennis players, so I think, but I've seen tennis kind of lumped into that. Those ones may be a little bit sooner, just given that their peak performance happens when they're much younger. But post-puberty is when that would be encouraged. Or supported, I guess. I won't use the word encouraged, supported. Any other questions? We're good? Well, thank you for having me. Alex may look at this picture. He may know this. I saw his backpack earlier. You recognize that? Yeah. So that's a team that I've just started working with, and I'm so happy to be a part of their road to the World Cup. This is the women's U20 national soccer team, and when we won the CONCACAF championship in Costa Rica earlier, and it was a fantastic day when we beat the US. Sorry for any US people in the audience, but it was a fantastic day, and then even more fantastic when we won. So thanks for having me, guys.